Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer. And so tonight, I want to update you on the latest steps we're taking to fight the disease and what you can do to help.
It's midnight in Wuhan, and the party's only just begun. This trendy nightclub has been packed every night since the summer. No more social distancing or masks. These young people are already living in a world without COVID-19.
A year ago, on December 30th, a 34-year-old ophthalmologist from Wuhan, China, posted a message in his WeChat group alerting fellow doctors that a new disease had emerged in his hospital. A year later, the pandemic rages on. Eunice Yoon joins us now from Beijing. Been a while, Eunice. How you doing?
Hey, Joe. We're doing relatively okay here. The pandemic, as you mentioned, has been raging on overseas, but here in China, things are relatively back to normal. I'm here at a restaurant, sports bar, which I spoke to the owner, and he said that back in January, he could have actually thrown a baseball through this restaurant because it was so empty.
This morning, Wuhan, China looks much different a year after lockdown. We've returned to a city where officials say there have been no new COVID infections in 251 days, and life appears remarkably normal.
New world order. Presidential decrees cascading from President Trump's pen. A border war with Mexico, kicking off the world's first leadership Twitter spat. Mexico's president announcing on a video they won't pay. Trump firing back on Twitter. Then it would be better to cancel the upcoming meeting. President Peña Nieto tweets back, "I will not attend the meeting scheduled for next Tuesday with the POTUS." Another decree cutting the Trans-Pacific Partnership adrift. The other 11 member nations and the rest of the world now figuring out what it means for them.
Sounding the alarm about a new variant of the virus that causes COVID-19. More than 50 cases of the so-called Delta Plus variant have been detected in India, and it's also surfaced in the USA and almost a dozen other countries.
Strict lockdowns of infected neighborhoods, travel restrictions, and the mass testing of entire cities. Chinese authorities have returned to the pandemic control strategies of last year as the southern province of Guangdong, home to 120 million, battles the country's most serious outbreak in months.
It's essential to take the most resolute, the most decisive, and the strictest measures to control gatherings and travels in high-risk areas to block the spread of the epidemic.
Dozens have tested positive with the Delta variant of COVID-19.
Total defrost of that White House relationship. Already Israel announcing plans to expand settlements. America's regional allies scrambling to respond. President Trump making good on some of candidate Trump's promises.
I think areas in the South China Sea that are part of international waters and international activities, I think the U.S. is going to make sure that we protect our interests there.
His spokesman tough on China, drawing swift Chinese condemnation.
The United States is not a party to the South China Sea issue. We urge the United States to honor its commitments.
Amidst all this controversy, the first world leader to visit President Trump.
Time and again, it is the relationship between us that has defined the modern world.
British Prime Minister Theresa May trading on historic US-UK bonds to boost business between the two nations.
Exactly 1 year ago, the city of Wuhan, China was under an unprecedented lockdown to contain a mysterious new virus. As Jeff Semple explains, life in the epicenter of the COVID-19 pandemic has largely returned to normal.
Lately, Bin Jiang has been feeling homesick. The Calgary father grew up in Wuhan, China. He was visiting his parents there last year when the city became ground zero for COVID-19.
It was scary. I've never seen the city like that.
Ottawa even sent a plane to rescue Canadians trapped inside, including Zhang's family.
And I want to begin by reminding you why the UK has been taking the approach that we have. Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses. And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. To put it simply, if too many people become seriously unwell at one time, the NHS will be unable to handle it, meaning more people are likely to die, not just from coronavirus, but from other illnesses as well. So it's vital to slow the spread of the disease, because that is the way we reduce the number of people needing hospital treatment at any one time, so we can protect the NHS's ability to cope and save more lives.
But the greatest threat on this front springs from the distinct illiberal and external actors who equate their success with fracturing the liberal international order. We see it in Asia and the Middle East, where China and Iran would clearly prefer a world in which they have overwhelming sway in their regions. And I'll not mince words. This movement is principally led by Russia. Under President Putin, Russia is working with every tool available to them to, one, whittle away at the edges of the European project, test the fault lines among Western nations, and return to a politics defined by spheres of influence. We see it in their aggression against their neighbors, sending in so-called little green men across borders to stir violence and stirs of strains of separatism in Ukraine. Using energy as a weapon, cutting off gas supplies midwinter, raising prices to manipulate nations to act in Russia's interest, using corruption to empower oligarchs to coerce politicians.
Well, I'm standing outside of a vaccination center here in Beijing, and they were telling us that they are seeing a surge in residents here who are looking to get jabs ever since it emerged that the variant that is spreading in the trading hub of Guangzhou was from India. The local officials have described the variant as alarming. And the reason is that health officials have said that the early cases have been traced back to a restaurant where the people who were infected were sitting very far apart, had no direct contact, and much further apart than with the original virus that came from Wuhan. Also, some of the cases are asymptomatic, and that just means that the detection of this particular variant in the country is going to be much more difficult, despite the fact that the several cities have put up thermal scanners in order to try to detect any virus spread. Now, perhaps the most worrisome is that authorities say that patients, some of them have already been vaccinated by the Chinese vaccine, which suggests that the homegrown vaccine might not be as effective against this new variant. Now, the authorities here have been quick to point out that none of the illnesses have turned deadly.
I'm speaking to you at what I know is an increasingly challenging time. A time of disruption in the life of our country. A disruption that has brought grief to some, financial difficulties to many, and enormous changes to the daily lives of us all. I want to thank everyone on the NHS frontline, as well as care workers and those carrying out essential roles, who selflessly continue their day-to-day duties outside the home in support of us all. I'm sure the nation will join me in assuring you that what you do is appreciated, and every hour of your hard work brings us closer to a return to more normal times. I also want to thank those of you who are staying at home, thereby helping to protect the vulnerable and sparing many families the pain already felt by those who have lost loved ones. Together we are tackling this disease, and I want to reassure you that if we remain united and resolute, then we will overcome it.
Mutation at the moment. So I think that that it's a bit of a distraction. What we have to be dealing with globally is the fact that we have a virus that is rapidly spreading, that does evade immunity to a significant extent and is highly transmissible and infectious. So that's the thing that we should be discussing.
Then how confident are health officials that existing vaccines are going to be effective against this new variant, but also Delta and other variants that may be popping up?
Well, the vaccines that we have were designed against the original virus, and they still, despite variants, confer very high levels of protection against severe disease and death in the majority of people. However, there are vulnerable people who have responded less well to the vaccine, who have lower levels of antibodies, and who will get severe disease, and some will die. But in the main, these vaccines are still highly protective. Everyone should be vaccinated if possible. But there are going to be people on the fringes, as I say, who become susceptible to the new variants because they are slightly less, somewhat less, controllable by vaccine-induced immunity.
How concerned are you? Like we're seeing numbers rise again in parts of Europe. We're seeing these variants. This is also at a time when things, particularly in Europe, are opening up. We're seeing sporting games. We're seeing travel sort of reopening. How worried should we be? Are we walking blindly into a new wave, do you think?
Well, certainly in the UK, we are experiencing significant rises in cases. And I'm not so sure about the data from Europe, but I will imagine that Europe will be lagging slightly behind. Of course, we have higher vaccination coverage than most of Europe, so the Delta is a much bigger risk for countries that have low vaccination rates.
On the legitimacy or activities of the United States government, including the existence of a plot to impose a new world order. Shortly after the rampage, police say they found a one-page letter in Ciancia's bag. It said he targeted TSA agents to, quote, instill fear in your traitorous minds, and also mentioned NWO, or New World Order. That's a century-old conspiracy theory, according to Mark Potok, who tracks extremist groups.
Basically identifies the federal government as an evil malefactor that is involved in a conspiracy to force the United States into a so-called one world government, known as the New World Order.
That's all. These are the only reasons you should leave your home. You should not be meeting friends. If your friends ask you to meet, you should say no. You should not be meeting family members who do not live in your home. You should not be going shopping except for essentials like food and medicine. And you should do this as little as you can. And use food delivery services where you can.
Tell you that has been targeted. Europe has seen the same kind of attacks in the past. With many countries in Europe slated to hold elections this year, we should expect further attempts by Russia to meddle in the democratic process. It will occur again, I promise you. And again, the purpose is clear: to collapse the liberal international order. Simply put, Mr. Putin has a different vision of the future, one in which Russia is pursuing across the board. It seeks to return to a world where the strong impose its will through military might, corruption, and criminality, while weaker nations have to fall in line. And from the first moments of our administration, even as we sought to press the so-called reset button with then-President Medvedev, President Obama and I have made it clear that there is no way for nations to behave in the 21st century. I was asked to lay out our policy at Munich in 2009, February. When I addressed the conference, I said, and I quote, "We will not recognize any nation having a sphere of influence. It will remain our view that sovereign states have the right to make their own decisions."
Total shutdown. People were banned from leaving their homes. Government workers brought bags of food to the foots of buildings to distribute to residents. This Franco-Chinese family were in Wuhan during those months of lockdown. Now that the city is free of the virus, many are wondering how in the rest of the world it could have got so bad.
J'entends ça souvent en France. On ne savait pas, parce que finalement on n'a pas beaucoup d'informations sur ce qui s'est passé en Chine. Mais moi, pour l'avoir vécu de l'intérieur, j'ai vu que on nous a forcés de rester chez nous. Ils ont fermé la ville entière, ils ont construit 2 hôpitaux. Je ne pense pas qu'on avait besoin de beaucoup plus de signes pour se rendre compte que c'était très sérieux.
What was once the centre of the outbreak has now become one of the safest cities in the world. Officially, there hasn't been a single case of COVID-19 in Wuhan for 168 days.